Myself, Tugolbai Zhumabekovich, I'm the senior teacher from this department, pathology department. Actually, I've had several opinions and options to discuss which topic is relevant to students. So here's the list of topics that I can briefly discuss with students. So if you're interested, you can ask questions. So let's start from the pathology, guys. As I'm the teacher of pathology, and actually I'm a clinical doctor too, but simultaneously I partially work in this department too. So there are several reasons. So 2004, guys, this is my take from school. Actually, from my entire family, I'm the only one who came into medicine. And when I told about my option that I want to be a doctor, everyone in my entire generation, they said, "Do you want to live a poor life?" That was the first question that was addressed to me. But today, guys, almost 10 years have passed, and I can say that I don't regret that I've chosen this journey. Okay, guys. So pathophysiology, guys, this is the only subject. Okay, one more slide. So if you can see, guys, pathology is in the meat of this list, and I can tell you, guys, we have several basic disciplines and clinical disciplines. So if you have studied those basic principles, very well basic disciplines, you can summarize those subjects in pathology. We have several clinical correlations, bridges with the biochemistry, microbiology, and this is one of the reasons why I have chosen this department. And if you have very good knowledge in this discipline, pathology, you can easily go into any clinical specialty, whether it will be internal medicine, whether it's going to be surgery. So I'm a doctor, cardiologist, and rheumatologist in the City Clinical Hospital #1, and I can tell you that the only thing you need to add is the diagnosis and treatment. If you have good knowledge in pathology, that will be fair enough. So guys, with pathology, why am I emphasizing this discipline? It summarizes the concept. So in medicine, guys, many of the students that I have observed, they think that it's all about the facts. When you learn the medicine, it's important to make concepts, because concepts are going to lead to clinical thinking, diagnosis and correct treatment, right, guys? And it helps you to adapt to clinical medicine. As you have learned from this medicine, like 5th semester students, right? If you have good concepts, they will adapt you to internal medicine, surgery, ENT, and ophthalmology, okay? And some other disciplines. And according to MTI, guys, so every year annually, you will have approx 50 questions coming from the single discipline, pathology. But simultaneously, if you read the questions 10, there will be a lot of pathology, and the last one will be internal medicine, last 10 of the question, or surgery. And next point is, if you want really deep, go deep to the disease pathogenesis, the pathophysiology is the single subject that gives you this opportunity. And is anyone here interested in research? So guys, this is the list of research works that I have been associated with. This is the last research works. The first work was done in the City Clinical Hospital #1, and in the summer period of 2 times, I've been to Tawashu. Do you know Tawashu? So if you go to Osh City, the next city of this country, there will be a big alpine place. We can take take some patients that were in the hematology department for a long time. So actually, there's one disease called, guys, thrombocytopenia, right? It's a chronic disease. The patients are usually it's kids. They're on long time they're in this glucocorticoid treatments. But imagine if the 5 months, 6 months, these kids have been on the glucocorticoids, there is no option left for parents. So we have taken some of the kids, around 40 kids, to this alpine climate, guys. And from the report, you can see, guys, so when the article is going to be published, I can drop you the links, and you will see that there are 2 cases of complete remission. 2 kids without any drugs recovered from this disease, and I think it's a miracle. Okay, this research work has been submitted to Indian journal. Next one is, guys, prevalence of osteopenic syndrome and osteoporosis. So Maybe some of you guys, upper semesters, you are familiar with this topic, osteoporosis, right? When the bone density decreases. So we measured the bone density in the population of the city, Bishkek. We visited some hospitals. Do you know how do we call these hospitals? Actually, in the upper part of this Bishkek, we have one institution. They care about geriatrics. You know geriatrics? They care for elderly people above 60. So we measured the bone density of those people. We measured the bone density of students. And interestingly, guys, we discovered that both in males and females, the bone density is below the standard level. But it's more prevalent in females, okay? So do you know the difference? Why it's common in females? Due to hormonal issues, okay? But the situation is bad, and we address that issue in this second research work. So third research work, guys, it's geriatric. At that same institution, we did simultaneous work, research work, but it's a global issue, and this been already published. So first three works have been already published, so we can drop you the link if you want. The last four, number one, breast tuberculosis, number four. It's a case study, guys. Actually, this is a very rare case we have found from the mammologist of the oncology center. There's one lady who was suffering from chronic mastitis, and no one could diagnose her correctly. So we took the biopsy sample from that lady and examined under the microscope two institutions here in Bishkek and Almaty, and the diagnosis was breast tuberculosis mastitis. Okay, so this case study has been already published. Okay, and these are the last works that have been. I wasn't involved directly in these last works, but there's one student who's very advanced in articles and research stuff, so he's going to be involved, and I'm just reviewing those last two works. Okay, and this is the last thing I want to tell you guys. This is how you should study. This is not the unified way of studying, but if you follow this way, you will have great knowledge base. So we know that there are 4 subjects, right? So this chart involves preclinical and paraclinical subjects. So anatomy, physiology, pharmacology, and pathology. So each of these 4 subjects, they have general part and systemic part. So if you master the general part of these 4 subjects, there will be these systems left, right? But if you guys start from anatomy includes embryology, gross anatomy, histology, and you go to physiology, pharmacology, and pathology, if you master these 12 organ systems, you will have great knowledge, okay? And the last thing, time management is needed. This is one of the reasons why many students are failing this Indian licensing examination, right? So, guys, I will briefly discuss this topic like that. You need to have your own setup plan for these 12 organ systems. And if you involve these 4 disciplines and add up some clinical disciplines, internal medicine, surgery, after getting done with these disciplines, you will have almost 80% done of this MCI content. Okay? So that's it. Thank you.